final forum for the state representative position. We have 3 candidates tonight who will be talking about the third major topic that we have discussed. The first one was education, the second one was jobs and workforce development, and the third one is this one, which is on healthcare. And as many of you know, there are very few issues that strike at the heart of philosophical differences as well as importance, and we'll hear that tonight from all the panel members. I'm going to give a few minutes to introduce. Let me just kind of go through what the format of the evening is. Partially, it's thank you and thank you for having me here. My name is Glenn Cummings. It's a little scary to be here because I'm a Morse High School graduate. And in Brunswick, that is always a frightening experience, but I'm trusting that I'm in safe hands. I just want to say thank you for having me here. I'm honored, actually. My party affiliation is Democrat, but the other two thought that I was weak-minded enough to be able to be neutral, so that was good. I also want to say that I'm very proud to be here with my good friend Stan Grozowski, who I served all 4 terms in the Maine House with, and he's terrific. So thanks for being here, Stan. And I just want to say our format. We will be doing about almost exactly as much as I can hold them to it. And having been a former politician, I realize that this is no easy task. But I'll try to hold them to 5 minutes apiece for an opening statement about healthcare. And in that, at the beginning, they could introduce themselves as well, a little bit about themselves. And then at that point, the questions will come from you. We'd like to get each person responding for about 3 minutes. So I'm going to try to, so if you ask a question and all 3 of them respond, it'll be about a 9-minute conference. So you can see in about an hour, which is about the time we've allotted here, about an hour, we'll only be able to get 3, 4, 5 questions in, depending on how disciplined we are. So that is our perspective. So let's start off here immediately to my left with Mr. Horch and have him start off with a quick introduction. Well, they'll be coming up to the podium because the podium is where the microphone is, so we'll be doing a little switch out each time.
Great. Thank you, Mr. Cummings. Yeah. Well, thank you everyone for coming. Again, my name is Fred Horch. I'm your Green Independent candidate for representative to the legislature here in Brunswick District 66. And many of you may know me as the founder of FW Horch Sustainable Goods and Supplies on Main Street. I'm married with 3 children in our public schools. And healthcare is one of the reasons I decided to run for office, and it's one of the reasons I decided to run as a Green. But before I get started, I would like to thank, again, all of you for coming tonight. I'd like to thank my opponents for agreeing to participate in a series of forums. I'd like to thank our volunteers who are videotaping this, and to say hello to the people that will be watching this on public access TV. And most importantly, I'd like to thank the taxpayers of Maine who have allowed me to run as a clean elections candidate. As a clean elections candidate, I raised some seed money, I raised some qualifying funds, but the majority of the funding for my campaign comes from you, the taxpayers, and so I thank you for that. And I hope you find this forum and the information we're sharing useful as you make your decision in November. So again, I am running as a Green Independent, and I'm delighted we can talk about healthcare because it is such an important issue. And as a former business owner, I can tell you that it affects not just people who are in the healthcare system, but it affects our entire economy and our entire future. And I decided to run for office in part because I think we can do a better job with our public policy. Healthcare is a very complicated issue, and again, as Speaker Cummings has alluded to, there's many philosophical differences, there's many different ideas. But I'd like to talk about some things I think we can all agree on. And this doesn't depend on party affiliation. It really just depends on common sense. And the way I think about it is we all have the same goal. Everybody here wants to have a good chance to enjoy a long and healthy life. And we'd like that same chance for our children and grandchildren. So we all have the same goal here. And if you happen to get sick, we all want to recover quickly. And we all want to give that opportunity to everyone else. So we all have the same goal there. And then finally, if you get sick and you can't recover, you'd like to die with dignity. And I think we can all agree that that is a goal that we all share. So we have a shared goal here, and the question really is, how do we go about achieving these shared goals? I think there are 3 priorities that we need to focus on in public policy that can help us achieve these goals. And again, I think there's a lot more common ground here than we take for granted, a lot more common ground than we could achieve if we work together, if we aim for common purpose, and we really try to come together across party lines. The three priorities that I see as utmost importance are, first of all, having a safe and healthy environment. The second is to have meaningful and informed choices for enjoying a healthy lifestyle. And the third is guaranteed affordable access to quality health care for everyone. That third one might be stretching a little bit. It might not be shared by everyone, but I think if we really get beyond the rhetoric, beyond the party positions, that we all do agree that everyone should have access to health care and that health care should be affordable for everyone. So let's start with a safe and healthy environment. One of the things that we really could do a better job with, and we need to do a better job with, is preventing disease and death in the first place. It's great to have a good medical system. It's great to have hospitals that can treat sickness, but it's even better not to have to treat illness that's unnecessary. And there are some specific things that we can do. By focusing on clean air and clean water, we prevent disease. By focusing on getting rid of toxins, by limiting exposure to pesticides, by limiting factors that we know lead to disease and death, we can prevent disease. And we can do a better job investing in public infrastructure that supports healthy lifestyles. I'm thinking of bike paths, I'm thinking of sidewalks. I had the opportunity to live with my family in Japan, which is a much healthier society to actually live longer. And one of the things that struck me is how many more people in Japan bicycle to work and move their bodies on a daily basis. That depends on public infrastructure, and we could build that infrastructure here in Maine. Moving quickly to meaningful, informed choices, this gets to workplace safety, this gets to education. We can put policies in place that help people make decisions, make those meaningful choices in their own lives to take control of their own health outcomes. And I only have 30 seconds left, but the big contentious issue, and I hope we get a lot of questions about it, is of course, how do we guarantee access to affordable health care? This gets into our insurance system. And whether you believe in a single-payer system or a multi-payer system, I think we can all agree that the current system needs work. We can do a better job with this. And whatever we do, my goal and my priorities will be providing access to everyone. I believe that we will lower costs and have better outcomes if we cover everyone in Maine. So again, thank you for coming tonight, and I yield the floor. Thanks.
Good time. Thank you very much.
First off, I want to thank you all for coming tonight. I'm kind of sad it's our last forum. I'm really excited that we all agreed to organize them. I'm really enjoying this campaign. I think we probably have one of the friendliest campaigns in probably the nation at this point. And I'm hoping we can continue this discourse on the campaign trail, and I'm really looking forward to it. My name is Mattie Daughtry. I was born, raised, schooled, and work here. I'm running first and foremost because this is my hometown. I've got skin in the game, and I want to make sure that Brunswick stays viable and vibrant, and that we have a sustainable future and just continue to grow from where we are. You know, we've had the base closed and we're moving forward, and I want to have a direct role in that and make sure that I'm serving the needs of all of you here tonight. I often talk about my childhood here in Brunswick, but I don't get to talk as much about another major reason why I'm running, and one that's really near and dear to me. I want to continue a legacy. For those of you who don't know, I'm actually wearing her picture around my neck. My late godmother was Representative Charlene Rydell, and I want to continue the work that she started. And she devoted her life to making sure that all Mainers had universal and affordable health care. She was a key architect, along with Trish Riley, who lives here in Brunswick, of starting the Dirigo Health Plan. And while Dirigo wasn't perfect, it was a step in the right direction. And what we have to realize is we need to take every little step we can to get us to that one day that I hope myself and my children, my grandchildren, will have access to affordable care. So I'm really running to continue her work and keep moving forward towards leading us towards that future where you don't have to fear bankruptcy from having a cough or a cold. So we only have 5 minutes, so I want to discuss some of the key things really quickly that we can do to move ourselves towards that future. One, I firmly believe, as Fred said, that every Mainer should have access to affordable health care. Personally, I have an autoimmune disorder and I lived without health insurance for a year, and it's frightening, and no one should have to go through that, especially not in a country that's as developed as the United States is. We're really behind when you look at us compared to other nations and their healthcare systems. One of my biggest things I'd like to do as your state rep is repeal Chapter 90, and I want to take a quick poll. Raise your hands if you've heard of Chapter 90 or LD 1333. That's a problem. You need to all go home and look it up. It was passed in the last legislature and will increase every one of our rates. The Republican administration pushed it through with limited oversight, saying that it would increase affordability for folks in healthcare and make there be more universal coverage. Well, the jury's back and it's not working. First and foremost, 90% of small businesses saw their rates increase. 54% of all individuals saw their rates increase under Chapter 90. And what's really frightening is that folks in rural Maine are having their rates raised. You know, if you're 23 and you don't smoke and you live in Portland, you're fine. But if you're over 55 and you run a small business and you live in Aroostook County, it's an issue. It's making healthcare more and more unaffordable for Mainers. Another thing is they tacked on a $4 tax to all individuals. Now this $4 tax was supposed to be used to cover folks with pre-existing conditions. It was going to go into a pool and help offset the cost. What ended up happening is they set up a nonprofit that meets in secret with limited oversight, that uses taxpayer money and is basically beholden to the insurance companies. So first and foremost, I could go on and I'll speak about it a little bit later. We need to repeal Chapter 90. It's not working. One thing I would like to see is work towards making sure Medicare is strengthened and protected. Now, this is a federal issue, but we can work with it at a state level and make sure no one's losing their benefits. I'd also like to increase transparency. We all need to be able to make informed healthcare decisions. Representative Seth Berry introduced a bill last year that made you list the 5 most expensive procedures in a hospital so that you can know what you're going into. Number 5 on my big list is we need to work hard to implement the Affordable Care Act. It was a step in the right direction, and we need to build from it. We missed the boat on setting up our own state-run health exchange, which we could have used a year ago. We already had the mechanisms in place, and our administration currently just passed it over based on partisan gridlock, and we were not able to set up an exchange. So now we're going to have to go with a federally run exchange. So we need to quickly act and try to implement the ACA Act as fast as we can to expand coverage. We also need to alleviate healthcare insurance costs for small businesses. My father in the back ran a building company called Sun House, and we paid a fortune for health insurance. And we need to make sure that that's not a major factor. It's holding businesses back. We need to restore regulations on insurance companies so that they can't raise rates without any oversight. And I'm going to go this way. Thank you very much.
Ms. Daughtry. And finally, Mr. Kahn.
If I say anything that offends anybody tonight, my name is Frank Connors. I work in a corner office. Call me in the morning, and for about 30 seconds, maybe he'll be flabbergasted, then he'll understand what's going on. In all honesty, my name is Grant Connors, and I do not work in this building. But anyway, I have to say that because he would expect it of me. So anyway, my name is Grant Connors, and I'm running for District 66 legislature. I am not a politician. I have never done anything political in my life until 6 weeks ago when somebody asked me to run. And I had no idea what I was doing then, and I probably don't still have an awful lot more now. It's kind of taken over my life, which is it's troublesome for me. But anyway, we'll see what happens. I'm here because somebody asked me to, and I had no reason not to run. And then when I thought about it, I was concerned about my grandchildren. And they are very young, and I will not see how things are for them, I'm sure. But when they get to be 20 and so on, it's important that they have jobs. It's important that they get good educations in the meantime. It's important that they have health care. It's important to me, I think, that I have a chance, at least an opportunity to try to help that. I'd like them to be able to stay here in Maine if they so desire. Like I said, I was a school teacher for 45 years. I have seen much of my life has been seen through a school teacher's glasses, and one of the things that's happened to me in the last couple of months is I'm having to look at problems through other people's eyes, and it's opening them, and I'm becoming a lot more informed as I go along, and hopefully I'm going to be able to make decisions from a more broader standpoint than instead of the ones that I was just using. I was a school teacher, and I went through an interview down at the library about 3 weeks ago, I think, and the whole idea was whether or not the school people would endorse me. I've thought about that, and I don't want an endorsement. I don't think I want an endorsement from anybody except the people in my district. I'd like to represent the people in my district, and I would like to find out what their concerns are and then go from there, and then use those concerns in mind with my grandchildren and their needs. As far as health care is concerned, I don't have a magic wand to wave. I'm one of those, I don't take any medications. And I'm not the absolute best person that you've ever met as far as my diet. I'm typical of so many others of us in America. We do what we need to do, and then when we're broke, we want to be fixed. And so this brings up some of the problems that we have here. Most people in this country feel it's a national right, but yet we don't have the system in place to take care of it properly. Hospitals test to protect against lawsuits. Those costs have to be covered. Doctors bill high to cover the cost of malpractice insurance. They have to do that, of course. The state and federal care, I've talked with people that don't know people within their family that have had medical issues, and it might be a year or so before the bill actually gets paid. Okay. Hospitals have to treat even if you don't have insurance. Insurance goes up every year. I'm well aware of that. You pay more, you get less. The insured people, of course, are paying the bills for the uninsured. So the problems are very, very obvious. The solutions are less obvious. Other people in other countries have had a little more success with it than we have. But I would say that we're still working on the problem, and hopefully we'll get a little bit closer all the time. Thank you. Don't bother talking to my brother. Talk to me.
Thank you, Mr. Connor. And now the part of the program, the format of the forum, really comes from you. We will open the floor up to questions, and then we'll allow each person to respond, unless it's a question that is specifically asked of you to an individual. So we'll leave it up to you. If you can't think of any, I'll have to make up a few, and that would be unfortunate, but I could do that. Senator.
If I might, Mr. Speaker, I haven't asked a question during any of these forums yet, and I've kind of regretted it after each forum. Each of the candidates are running from a party. You all have a party vehicle that you're running on. And there's, in healthcare, as much as in jobs, as much as in education, there's a different philosophy in the three parties. Can you all explain your vision of what that philosophy is, and how you either agree with it or don't agree with it?
Anybody want to start? Okay.
Thank you, Senator. It's an excellent question. So I'm running as a Green Independent, and the joke is, I don't belong to any organized party. I belong to the Green Independent Party. So it's a party that's very small and very long on values, and our values really have to do with treating everyone fairly and thinking about the long term. So when we think about healthcare, again, we're thinking about prevention, we're thinking about being efficient with our public funds, and we're thinking about making sure we cover everybody. So there's a lot of talk about insurance, about the Affordable Care Act, but there needs to be more emphasis, more discussion, and more funding further upstream. because we're treating a lot of illness and disease that we don't need to treat. It's unnecessary. And we're doing that because there's a lot of things happening in our culture and in our environment that are making us sick. So the Green Party believes in looking at the root causes for disease and investing in programs and policies that will address the root cause of disease. We do believe in a single-payer system at the national level, but again, at the local level, here at the state level, we believe that there are many things that the state government could do that would help prevent disease. And again, I talked a little bit about them in my opening statement, but a clean environment is paramount. We need to protect our air, our water, we need nutritious food, we need communities that support us. Love and respect is an important part of being healthy. So that's what the Green Party is all about. We don't have representation in state government at this point. We're hoping to gain that representation. I hope people will keep an open mind, listen to what we have to say. And again, I'm running as a Green Independent. I'm not ashamed of it. I'm proud of it. But I know a lot of people don't understand what that means. And so please, if you have questions, I appreciate the conversations. I'm knocking on everybody's door. I have made it a goal this time to knock on everybody's door. Last time I was not able to do that because I owned a store, but this time I'm able to put more time and effort into my campaign. So appreciate the question. And again, I ask voters to keep an open mind when you cast your ballot. The Green Party, I think, does have some important contribution to make here in Maine. Thank you.
George.
Well, I'm running as a Democrat, and I'm running as a Democrat because I like what the Democrats have done. Are we perfect? No. Is any human being perfect? No. I'm a big fan of where the Democrats stand, and they've been committed to making sure that all citizens of this entire nation of Maine have access to affordable and universal health care. When you historically look back at what the Democratic Party has been able to accomplish since the beginning of our party, it's astronomical. Fred was just talking about the environment, and I completely agree. We have so many things that are caused in our health system by our environment. I can speak to it personally. I've seen 2 dogs die from lawn pesticides, and I firmly believe in labeling them. But we're a much better world and nation environment-wise because of Democrats. I'd like to personally thank Ed Muskie. We're coming up on the anniversary of the Clean Water Act, and I believe in the work the Democrats started, and I want to keep fighting hard. I will say, honestly, I think the Affordable Care Act wasn't perfect. I would have loved to see, a universal single-payer system, but we have to take every step we can to get closer to it. I believe in compromise that moves us forward, and building coalitions that we can then keep marching forward. I don't want to move back, I want to move forward, and the Democratic Party has historically been that party that has introduced consumer protection, environmental protection, universal health care. The way I always say it, you all enjoy your weekend? Thank a Democrat. You enjoy minimum wage? Thank a Democrat. And that's why I'm running as a Democrat.
I'm running as a Republican because I registered a Republican in 1964. And I'm not the same person I was in 1964. I've lived a long life, and I've seen an awful lot, and I've done an awful lot, and I've been in an awful lot of places. And now here I am. And I'm still a Republican because I registered as that, and there was no reason to particularly change it, to fix it. I was registered as a Republican so I could vote, and I can still vote. And so that's what I do. As far as my personal views about health care and so on, I come from a funny place. I don't have anything that I didn't work very, very hard for and pay for myself. I drive an old 2000 Dodge Ram. My wife drives they call them loser cruisers. That's a little bit newer, but not much. We don't have what we can't pay for. So healthcare becomes a real problem. There's an awful lot of people that feel like they need to have excellent healthcare. Everybody should have it. I would agree with that. I came from the school systems where most of the kids in the school, the only healthcare they had was the nurse in their office. That's a crime. But it's also very hard for me as whatever political party you represent, to look at someone and say, look at the situation and say, pay for it, pay for it. I can't do that in my real life. I can't imagine how the country or the state can do that either. I think we have to moderate what we expect, and I think we have to take a little bit of care for ourselves. I am not, Mr. Horch mentioned going to Japan. I was in Japan a few years ago. One of the most amazing things that I saw there, walking up to a Coca-Cola machine, and you put $1 in, the equivalent of $1 in, and you had 4 choices of which size Coca-Cola you could buy, you would get. Think about that. This is where, in this country, we're off the charts. You could buy like a 6-ounce bottle of Coke, or a 9-ounce bottle of Coke, or a 12, or a 16 for $1. Now, what would anybody in this country do? They would take the 16, guzzle it all down, and then
30 seconds.
Right. Anyway, in their culture, they would take what they needed, not what they had to have. And so I think, you know, if I were in the legislature, I would like to see some common sense approaches to some of the kinds of things that have to be dealt with. You know, encourage people to take care of their health a little bit better. We're in a flat economy. It scares me to think about having anybody make me pay for more when I don't have the wherewithal to do it. I'm retired, for God's sake. That's right. Thank you.
So on a side note, it's very nice of Ms. Daughtry to offer me the new iPhone for moderating this event. Yes, back here. Yeah.
Thank you. I'm Kevin Twine. I live at Oak Street. You mentioned Japan. Japan has a healthcare system that covers everybody at about half the cost we do with a single-payer system. I think I want to direct this question to Mattie. You mentioned single-payer also. How would you go about implementing this in Maine within the context of the Affordable Health Care Act?
So I'd like to end up with a single-payer system, but first and foremost, we need to take care of the cost of service. Right now, if we were to implement directly to a single-payer system, we wouldn't be much better off. So we need to approach the system as a whole. Part of the reason we pay such high costs, we need to lower administrative fees, we need to get rid of unnecessary paperwork, we need to get rid of unnecessary testing for medical procedures that aren't really there. We need to remember it's about patients and not about profits. And once we've taken care of that through a number of different methods, we'll be able to move towards a single-payer system. As I said, I'm a fan of transparency. We need to remember it is a consumer-driven system and we need to be informed. So I like the idea of being able to see what services at the hospital are the most expensive, and so you can make an informed decision of how much this is going to cost me down the line. I also think we just have a lot of unnecessary costs that we can drive down and have a better system, especially when we look to our neighbor up north. Canada is doing it for much less money and providing much more universal care. I think one way we can expand at least coverage before we get to single payer is something our current governor is not a fan of, but expand the Medicare coverage that is part of the Affordable Care Act. We really need to take advantage of that. We could have so many more people with health insurance coverage if we took advantage of this brief opportunity to have matching funds. Another thing we always forget about in state costs when we're budgeting is that the federal government does pay 63 cents of every dollar that goes into our Maine Care program, not problem. So we need to remember that we have a great opportunity to approach this as partners with the federal government. But as I always say, Maine knows what's best for Maine, and so we can look at the systems we've already pursued. We've looked at Dirigo, which was able to expand coverage. We didn't have the cheap rates we wanted, but that was because we had trouble negotiating with the insurance companies. So another thing I'd like to see is have better oversight and better negotiation for rates and premiums to make sure, you know, as I said, that someone up in Aroostook County isn't paying 3 times what someone down in Portland is doing. So I hope that answers some of your questions. I'll be sticking around afterwards if you'd like to talk about it more in depth, but I think those are some of the first steps we can take.
Hi, Jeff Moss, and I live on Main Street, and Director that Mattie said she also brought it up, and that is, you mentioned our neighbors to the north. I have friends who live north of the border, And one of them, in a conversation during the height of the healthcare debate down here, mentioned that she is absolutely confident she can go see her doctor if she had an acute condition or was treating some long-term disease. But she has not had any preventative care for 7 years. She can't get in to see her doctor. So you bring up Canada as an example. What don't you like about the Canadian system? Or talk about any other system. Talk about anything in Europe where socialized medicine is quite common. What doesn't work about those?
So you already hit on one of the biggest problems I have with, I hate using the term socialized medicine, but systems we have in the United Kingdom and in Canada is where you have these waiting lists for basic surgeries, and people seem to go long periods of time before they get the care they need. I'm not sure, as Grant said, neither of us have magic wands, but that is one thing that would need to be addressed in a system like that. And also preventative care. I think any healthcare system we have has to have preventative care. It's a fiscally prudent move. There's a study that was just done that for every dollar that we invest in early childhood education, prevention, any early childhood program, we get back $16 in savings. Preventative care is part of the reason we have such high healthcare costs. You know, if we're making sure we're taking care of minor things, we're working towards curing America's obesity problem, we're making sure that folks don't let things like pneumonia go unchecked, that we teach people basic health skills, we'll be able to drive down costs. And in my belief, when we have a lower cost basis, we'll be able to have a far more lean functioning system. So that's a huge thing for me. To be honest, I'm not quite sure what else I don't like about those other systems, but those are the two big things. I have a friend who lives in the United Kingdom and her father had to wait a long time to get a surgery that was medically necessary. So I'm not quite sure what method, but I absolutely agree with you on that, and preventative health care is key.
Yeah, I have a social needs son, so we have a kind of a special case that actually involves preventative health care. I have a son with very serious brain injury that was sustained from preventative health care, and as going through the process of dealing with his medical picture, have really found you find all the holes in the system when you have a special needs child, and part of our journey has been realizing that a lot of the preventative health care checklist that people go through, there are people on the ends of the bell curve who actually can cause them harm instead of helping them. For my family, especially for my child, we're in this weird place where we have medical insurance. I don't really want to use it because the checklist doctors, kind of the doc in the box, they don't really know how to address his special needs. So we found alternative practitioners that do, but we've had a pocket for those. So we have health care that we can't use for preventative care because we have to pay for cash for the people who will we are moving towards an individual patient model, which medicine's been talking about. We need to move towards individualizing patient approaches, but we're not there yet. So we have to have the insurance in case somebody gets hit by bus insurance. So we're in that place where we have to have insurance we can't use, so we have to go to alternative healthcare practitioners. So the problem is if you have a single payer, if you have a government socialized healthcare plan, he pays the piper calls the tune. So if you've got this plan, they will say, well, you have to do this, you have to come in for these appointments, you have to go through these, our checklist, and if you don't say yes to these medical procedures, then there's consequences. So I want to know about opt-out options. If you're proposing a single payer, any kind of socialized medicine, how do I, with a special needs child, be able to say, no, thank you over here, but still have access to it in case we have an emergency.
So we have
and covering alternative health interventions as well.
So I think if I got the question right, we have two people who have said that they would prefer a single payer health plan, so we'll address it to those two. I think the question is, are there opt-out options for those?
Opt-out options, and what about alternative health coverage?
Covering alternative health.
Well, that is a great question, and that's why I think we need more diversity of political opinion and more people at the table, more ideas discussed in Augusta, and not just have a black or white Democrat, Republican conversation. The Green Party has long been aware of this issue. We actually think carefully about what prevention actually prevents. And immunization is a real challenge because a lot of people feel that immunization leads to autism, The scientific literature doesn't support that conclusion, and so what do? The Green Party comes down to democratic control. We believe that if we had a single-payer system, it should be at the control of the people. We should have democratic control, local control. We should model things similar to the way we do public education, where we have local communities really investing, and you have variations across the country. And healthcare is the same thing. There are different cultural practices, there are different views of evidence, there's different standards that people are comfortable with. So the fact that you could have a public insurance system that makes sure that everybody is covered, the I'm hit by a bus system, doesn't preclude having choice and alternative medicine as well. And the Green Party, again, believes in local control, believes that one size doesn't fit all, really feels strongly that individuals should have control over their own lives, and especially things as important as healthcare. I'd like to contrast what we have now to other countries. I have lived in the Soviet Union, I've lived in Japan, I've lived in France, I've had experience with a lot of different healthcare systems. The United States has the worst healthcare system from the perspective of getting paid for services and from the perspective of someone who doesn't have a lot of money. If you're rich, we have a great system. But if you're not rich, not so good. The people that decide what you can do are the insurance companies. They're not elected, and they have a profit motive. In a lot of cases, their interests are opposed to your interest. And so the system we have now is not good, and it's not serving the people that have special needs. It's driving up the cost for everyone else, and so there's a lot of resentment. If we had a public system when we're all in this together, and we could decide things democratically, and we trust local communities to make their own decisions, we would have a better system. And I'd like to...
30 seconds.
30 seconds. I'd like to respond to your question about what's good and bad about other systems. But one thing that's really great about the United States is we have the best medical care in the world. Again, it's available to you if you're rich, but it's just not available to you if you're not rich. So other systems have trouble investing in the cutting-edge research that we are able to develop here in this country. So whatever system we develop, we want to make sure we retain our research and development component, because we do lead the world in pioneering new techniques, and we do have a great system, but it only works for those who have a lot of money. So we need to fix that part without losing the innovation and the excellence that are characteristics of our system. Thanks.
First off, I want to thank you for your question about alternative care. I didn't get a chance to talk about it, and it's something that's very near and dear to my heart. I also worked at VSA Maine, and we were an organization that worked with individuals with disabilities. And part of our role, we worked with the arts and using the arts as a method to level the playing field. But we also worked with artists on apprenticeships of how do they afford health care and how do they work through the system. So just wanted to mention that. I am a big proponent of alternative care. And when I say universal or single payer, we have to be careful that we're not describing a one-size-fits-all system. As I said, I have an autoimmune disorder, and I've had to seek alternative care and had to pay through the roof for these services. My friend Anna, one of my best friends over here, she has chronic Lyme disease and has to seek alternative treatment because it's a disease that's not necessarily recognized by the medical community. It's up and coming, we're not really sure what's going on, and because we're not funding the research, you really do have to go off-label and off insurance, and the price that you have to pay to get these methods that are really helping you become healthier are astronomical. So first and foremost, before you even get to universal or single payer, I'd really like to see us as a nation investing in more funding for research of a lot of different health issues. For example, Lyme disease, the Epstein-Barr virus, which causes mono. 15% of folks who get it continue to have symptoms, but they're not funding the research because it's not profitable, because it's just a small portion of our country. So I'd like to see us increasing funding with that, so we're aware of what options folks are going. You know, we need to make sure that before a vaccination is out on the market, that it's thoroughly tested, and you know that folks have a way to get that information easily. Another thing is, as I said, healthcare should never be one size fits all. What works for one patient will never work for another one. If we were giving everyone the same level of medication, we'd have huge, huge issues. And within any healthcare system, whether it ends up being single payer or universal or Medicare or what we just have right now, we need to make it easier for folks to be in control of their care. It boils down to you know, I might not be a doctor, but I know what feels right for me, and you know what feels best for your child, and you should be able to invest in that care and not be fought left and right. I mean, I just saw firsthand, I was trying to get a prescription, and the pharmaceutical companies realized that this medicine wasn't profitable and are driving all people who are taking the prescription towards a brand name. We shouldn't be dealing with these type of things where profits are coming before patients. So I don't have a magic wand, but we need to make sure that people are able to get the health care that they deserve. So thank you for your question.
But I grew up in a different generation, and I had an appendectomy when I was a 12-year-old after I worked 6 hours. You do what you have to do, and as far as raising children and all the other kinds of stuff, whether you have health care or not, I think all of us know how to take better care of ourselves. Whether we do it or not is kind of a choice thing. I believe all of us know intuitively how to take care of ourselves. I have a friend who died a few years ago who was a chiropractor, and for years I introduced him to my friends when we were somewhere else as my friend the quack, because he was it was crude, I'm sorry. But that was in times when chiropractors were not acknowledged as being part of the medical profession. I hurt my hand here one time and had an injury, and I went to my doctor, and they wanted to operate. And my mind, the way it works, is, well, it didn't take an operation to get me there. It shouldn't take an operation to get me out of it. And then I talked to him, my friend the quack, and he fixed it. For a while, I couldn't even squeeze my shaving tool thing. So, you know, there's more than one way. I would agree with everybody here that there's more than one way to get things fixed. The problem is, in this culture, of course, we have some of the best medical research in the world. We have medicines that are awesome. We have all kinds of machinery and stuff. It's all very expensive. And most people, when they get sick, they want the absolute best that they can have, whether they can pay for it or not. And you know, the way the insurance companies work, of course, is they want to show a profit at the end of the year. And a lot of things, I think, can be adjusted, or just when I go to the doctor, if I listen to my doctor, and my doctor says we can solve this by this problem, you probably don't need a CAT scan or an MRI. It's going to cost several $1,000s more. Let's just take the doctor's advice and let it be at that. I think oftentimes in this culture we have a tendency to go for the most expensive process and let somebody else pay for it. I don't agree with that. Thank you.
Thank you.
As I understand, I may be mistaken, but I think the Obamacare does have a window for states to take action on their own to produce a reasonable health care system for themselves, for their state. Charlie, my gal, who many mentioned, I certainly thought of her as a friend of mine, and I worked with her partly in her effort to get a single payer health care system in the state. And she worked really hard on that. And that was some years ago. Pat Lamarche, who was our candidate, Green candidate for governor, 2006, had a entire worked out, a well worked out plan that the Maine could do it alone. And I know during that time there was also a strong legislative effort at that time to get something before. I know East King was not terribly. There was either going to be I think, a stand on a study committee and so on. So we were reaching very closely to that reaching closely to the real thing, which I think both our candidates are for grant very, very strong for. And that is giving universal health care to Mainers. And why not? So I guess my question is, since that kind of thing is within reach, and as I understand it, the Obamacare approach permits that kind of state initiative, I would like to know whether the candidates that we have here today will make it their top, a basic priority come January to really get right in the trenches and work for that, right off the bat. Maine can have its own health care along with other states that are going to use these funds.
Thank you. So we have a question from the floor, the immediate enactment of Obamacare, state by state, in this case Maine.
Yeah. So I believe that the premise of your question is correct in that Maine could develop a universal system that would work with the Affordable Care Act at the federal level. And Vermont is pursuing that path right now. And I've been, to the best of my ability, following that and really trying to think, you know, what Hawaii did, what Vermont did, what Canada's done. What is the best way to move forward? How do you get from where we are now to where we want to be, which is an affordable system that covers everybody? And it's important to note that we do cover everybody in some fashion now. If anyone here is so unfortunate to be hit by a car on the way home, you will be served by an ambulance and emergency room personnel. And the hospitals are required to provide that coverage to you. So we are insuring everybody to a certain extent. The only problem is when it comes to actually pay for that insurance we provide, we're just stiffing the hospitals on the bill. So we already have a commitment as a society to provide health care to everyone. What we're really talking about is how to pay for it. Who should pay for it, and when should you pay for it? So absolutely, your question, should we work now and will I make that a priority? Absolutely. I do believe that a single payer system, public insurance, but private health care is the way to go. And to make sure that people understand, there's a difference between socialized medicine and public insurance. And the difference is this. In a socialized medicine system, it's essentially TRICARE. TRICARE is what covers our military right now. So if you serve in the military, you are covered by a socialized medical system. In a socialized system, the doctors work for the government, you're covered by the government, what you get is all determined by the government. But what other countries have done, and what would serve Maine best, in my opinion, is a private healthcare system with public insurance. Again, we already, to some extent, cover everyone with this public insurance. It's just we don't pay for it very well. We don't do it very well. It's incredibly stressful. You can become bankrupt because you get sick and lose your job. This system makes no sense to anyone else. And again, I've lived in many places. People always ask me, how can you stand it? How can you start your own business in the United States when you have to pay for insurance for your workers? We don't have to do that. If I went to Japan or Canada or France or Great Britain or Germany or anywhere and wanted to start a business, I can just check off my list health insurance for my employees. But when I'm trying to hire people here, when you're trying to grow a business, that is on your mind and it drags you down. So we definitely can do a public insurance system, and I will work very hard to make that a reality if I'm elected. Thank you.
So I would be a big proponent of single-payer health insurance, and I don't know if you're familiar with Representative Charlie Priest's bill that he introduced every year. I'd be very proud to sign on to that. To address the question of Obamacare allowing us to implement a single-payer system, it does allow that. The problem is we've missed the bus of setting up this health exchange. And like Fred said, I've been looking at what Vermont's been doing, and it's an excellent example of where we can go with a single-payer system. Oregon is another great state to look at. What they're doing are community-based service centers where you have localized health care, where you're coming in and your needs are met based on a community basis, and it's much more local control. So those are two models that I'm interested in looking at. But my concern is that we miss setting up the health exchange at a state level due to this current administration's view of just digging its heels in and saying no. So yes, given opportunities, I'm going to work my butt off to make sure we have a single payer system, and to make sure no matter what, whether it's single payer or working with the ACA Act, we're going to make sure that health insurance is more affordable and more accessible, and that folks know what's going on. I'm very disappointed that we didn't set up that exchange, and we're going to work with the federal system, but hopefully there'll be enough room and wiggle room within the federally set up exchange to hopefully work towards driving that localized single payer system. So.
Thank you, sir. Mr. Connors, do you want to respond?
Yes, yes. I can accept that everybody needs health insurance. I believe that the Obamacare, as I understand it, is not going to fix everything. And I think there needs to be more work on how it's going to work. I personally believe we have a huge national debt, and some of that national debt, I have to believe, is money that's owed states with health care and all kinds of other issues. So it's very hard with a flat economy to say, well, sure, we're going to fund everything that comes down the road. I believe that everybody needs the health care. I'm not sure that the Obamacare, as it is right now, is the absolute best way to go. It's a start. I'm not sure it's what we eventually will wind up with sometime in the future, but it needs to be looked into very closely. As a school teacher, the years I taught, I had lots and lots of kids in my classes that were 8th graders, but they did not have the ability, reading ability and so on, to function at that level. So I spent an awful lot of my time problem solving and trying to figure how am I going to get to some of these kids with their the problems or whatever that they had. I would like to think that if I were to go to the legislature, I would look at some of these very closely and try to go towards fixing some of the problems that I know are going to be there, and see if we can come closer to a better, more workable system. Thank you.
We're really out of time. What we'd like to do is to have each candidate come up and do a summary. Does that make sense?
I have an alternative proposal. If Senator Grzowski would be willing to moderate another half hour of questions, if people still have questions.
Can we get a show of hands of folks who'd still like to ask a question? Because we want to make sure that everyone's questions are addressed.
Great. Senator, you're in.
Would you be willing to stand for us?
The hardest part is
second
the
motion.
That won't work, but I got to talk right there with Russ.
All right, that sounds great.
Thank you, Speaker.
Great. Yeah.
Appreciate your help.
Thank you. It's terrific.
So what just happened? The guy that's being paid is going home?
Yeah.
You're in a snake pit, man.
Okay, all right.
Okay. Good luck.
I feel really left out. It's your brother's business.
Frank didn't step up to the plate. I wrote him a giant love letter.
Well, this will be interesting. Nothing bipartisan about Maine. Ms. Burbank?
I'd like to ask you all this question. The Department of Health and Human Services of the state of Maine seems to capitalize, take room in our headlines, we put it that way quite often. The computer system doesn't work, or we've got the numbers wrong, or they didn't get paid, or we didn't get paid. And I think that department, being a very important department relative to the health of the citizens of Maine, maybe needs some attention and maybe doesn't. So I would like all of you to comment on whether you have ambitions for improving it or whether you think everything's just fine.
Now that we have a different moderator, how if we have a different rotation?
Yes, sounds good.
You want to come up and answer,
Want me to start?
We'll reverse this one.
Can I ask on to her question? Could you let us know if any of you are interested in being on the health committee?
I'm sure they all are, but it depends on leadership to what committee they'll be assigned to. But I'm sure that they would all be, as all of us are. Grant? Get on.
Certainly. As I said, I'm not a politician. I really don't know what I'm doing. I'm trying to, this is that's part of my life here, and I've got to have a crusade. I've got to have something to do. When I retired, I had no reason to get up in the morning, and it's tearing me apart. I'm either going to spend my time with my grandkids, making sure that their lives are going to be better for the rest of their lives, or I'm going to do something else. I have to do it. So that being said, I took on this opportunity, I will have to say, of running for the legislature in my district because I was asked, and I thought, well, why not? That's something I've never done. There's no reason why I couldn't do it. But I'm starting from behind, and I'm learning as I go. So I do not know exactly how the system works up there. I do not know how you get onto committees and all of that kind of thing. I would have to learn as I go. As you can see, the three people that are standing here, I am probably more going to be in quicker need of health care than these other two fine people here. Maybe not, I can't really tell, but nevertheless, I would have to say, as just off the top of my head, it probably is not the committee that I would necessarily go to, because I've not been a particularly good person as far as taking care of my health. And I've gotten this far, and that just happens to be the way it is. But I would say, as I got up to the legislature, if I did, then I would sit in the back row probably and listen very, very carefully, and I would take in as much information as I possibly can, and I would use what intellect I have to sort things out and try to come up with reasonably intelligent solutions based upon how the system works, which I don't know right now. Thank you.
That's a good understanding. None of how the system works. Stop.
I would say that we absolutely need to take a look at DHHS. For the headlines we've been seeing coming out of that department are a little frightening. There's been a lot of money that has either been wasted or magically found in Department of Health and Human Services. So I think first and foremost, we need to make sure that we're having efficiency, transparency, and accountability with the department. We need to make sure that we're not double paying. It seems like a basic interest, but we need to make sure we're being fiscally prudent when it comes to this. So I'm not quite sure what the answer is, but I think we need new leadership in there. We need to make sure that the public is aware of what's going on there. And I think first and foremost, we should install a new computer system. I think that would be a really good investment. Just gonna put that out there. And also, I think it needs to be accessible to the community. Our governor's current motto is open for business, and I'd like it to be open for comment. I think we need to be able to get up there and see what our taxpayer money is paying for and really understand the system. I don't think any of us in here really have the perfect knowledge of how everything works up there, but we should be able to find it out. So that's what I'd like to work for, and I would be interested in serving on the Health Insurance Committee. I say my first and foremost interest is education, but I have no idea what committee I'll end up on, but my interest, if I'm allowed to run law, would be the Insurance Committee, the Agriculture, Conservation, and Forestry Committee, the Energy Committee, and Marine Resources. So basically, I'm just really excited to go up there and work.
Well, like Mattie, I'm just excited to go. If I have the chance, I'll serve wherever I'm put. I'd like to be on the Energy Committee. I worked as a computer consultant. I have a degree in computer science, so I have some empathy for the poor people who are trying to get our computers to work in the state government. But I do believe in legislative oversight. So I do believe that when it comes to accountability, if you really mess up, the leadership of those departments needs to change. We need to have a good plan for fixing the system. As you mentioned, that is so important to so many services, so we do need to have just a good way to keep track of people, who's been paid. It's more complicated than you might think. When I was in law school, I helped people qualify for benefits, and you get into these systems and the bureaucracy just kills you. I'm hoping that, and everybody's aware of this, so the solutions are not obvious, but I'm hoping that if I'm up there and serving, that sort of like Grant, I'll keep my eyes open, I'll keep my ears open, I'll try to network with as many people as I can, figure out how I can be effective, see where I can make a difference, and if I can offer any assistance, I will. But again, like I said, I do believe in the value of legislative oversight. I think if you're paying for these programs and they're not working, it is our legislators' responsibility to find out why, to make sure that the departments have a good plan for correcting them, and to make sure that we have the right people in place that can execute those plans. And in terms of all the details, really, until I get up there and into it, I just don't know. But again, if I had a choice, I'd like to serve on the Energy Committee. I have a specific piece of legislation, a policy position I think would do great things for Maine's economy. It's a feed-in tariff. It has been introduced already. It didn't get very far. But I do think that if people really understood what this meant for Maine, that could be something we could move forward. And as I alluded to earlier, I do think that moving towards a single-payer system, but really focusing on universality, is critical. So whatever I could do to convince everyone of all parties to come up with some system that really covers everybody, and then we have good accountability and where trust our state government to actually execute. That's what I would be looking for in terms of healthcare policy and the Department of Health and Human Services.
Thank you. Other questions?
This doesn't need to be a long answer, it doesn't need to take a minute or so for each person. So really one sentence would do it. Part of the problem that we have is availability of medical services. And University of New England is opening a dental school in the state of Maine. I understand it's the first in northern New England anyway. What would your position be on a new medical school in Maine?
Grant, would you like to build that one? Or?
Well,
I'm trying to
sure.
get some variety in here. Great variety.
Thank you. Medical school in Maine, is that what I heard?
Yes.
Yes, okay. It's an awesome idea. A negative side for that for me is we have I got an undergraduate degree in Maine, I got a graduate degree in Maine, I got lots of coursework after that in Maine, and I love the educational system that is here. There's some problems, perhaps, but nevertheless, it's good. My biggest problem, though, is we educate people and then we ship them out. And if there were such a thing as a medical school here in Maine, a new one that would be started, I would think that along with that would have to go some kind of a sister plan, and I don't know how this would be done, but a sister plan to encourage the doctors that are the medical professionals that came out of such an institution to be able to help them to stay. That would be an extreme priority for me. We have one of the new places out at the base already is some more college class, opportunity and so on, and then they're going to go. And so many of Maine graduates, University of Maine, all of our schools, they go someplace else and take their expertise somewhere else. I think we need to create some kind of a situation where we have jobs here and then we train people for those jobs, and we have whatever we train here, work out some way to get them to stay. We need them. Thank you.
Well, Grant hit upon something that's near and dear to my heart. One of the reasons I'm running is to make sure that my friends can stay here. I was educated and I chose to stay here. I didn't flee the state. My friend Anna and roommate, she's here, and my boyfriend returned from Massachusetts to make sure that we have a vibrant, sustainable future here in Brunswick. So just wanted to touch upon that. But I am a huge proponent of making sure that we have a medical school in Maine, and I was really excited when I saw the University of New England's dental school open. Dental care is a huge crisis in Maine right now. A lot of dentists are not accepting new patients, they're retiring, and there's a huge availability problem in northern and rural areas in Maine. But I just found out this morning that Tufts has just recently entered a partnership with Maine Medical. And what happens, you go down to Tufts for 2 years to start your medical school, and then you come back and you do your rotations at Maine Med. And the entire purpose of this program is to train general practitioners, which we need here in Maine, to stay in Maine. And there are very large scholarships to make it financially affordable for all socioeconomic levels of Mainers, and I am really excited about this opportunity. I don't know everything about it, but I have a friend who's looking at medical school, and by golly, I'm going to try to get her to go there because we need more general practitioners. So I'd be in favor of anything that would increase our educational opportunities to get skilled technical doctors here in Maine.
So I guess I'm a little confused because I thought we already had a medical school in Maine that does osteopathic degrees. I remember going to a conference there and studying childhood obesity. So maybe that school's closed. I haven't heard anything, but I believe we already have a medical school. And so the question would be adding another medical school. And I think that's a great idea. The question is, of course, funding. Our University of Maine system is seeing a decline in enrollments, whereas our community college is seeing an increase. And so it seems to be people are very concerned about the debt level that they're getting when they come out of school. And as I was doing my doors, talking to everybody, I did talk to a few doctors, and one of them had a great suggestion, which is loan forgiveness. And so that if we had a medical school here, find a way to forgive loans so that people would work in Maine, again, that raises questions of funding. So the real issue is how do we fund our existing system of higher education, and then how do we enhance it we have a real demand for medical care in our state. We have an aging population, and so some nursing programs and other medical training programs, I think, are where I would invest our money now, but certainly would like to work toward the goal of having another medical school. I believe we can't have too many doctors here, but when we do that, we really, I think, also need to take a look at how do you pay for higher education. It's becoming increasingly difficult for people to make that decision to get a higher degree and then figure out how they're going to pay for it. So this is a problem that's not just medical school, but all higher education, and it really needs to be grappled with. So I think realistically the idea of opening a second medical school in Maine is a stretch right now, but it's a very good idea to work towards. And along the way, we really need to think about how to make sure people can afford to pay for their education, and then how do we retain those folks? Because again, the goal would be, if we have a medical school here in Maine, is to have the people that graduate practice here in Maine. And just really quickly, I have several friends who are doctors, and there's a lot of demand for specialties. So if you specialize, I have a friend who's a neurosurgeon, and I think he would be one of only 2 in Wyoming or something. They offered him millions of dollars to move out to Wyoming. He wanted to live in New Jersey. But so there's real demand for these specialists, and then the primary care physicians are sort of overburdened and overworked. And so I think even within the medical profession, if we did increased training for the medical profession, we need to look at what kinds of doctors we're training, how the medical profession is compensated, and make sure that we're really, again, investing in that preventative care, that we're training doctors who can prevent disease, and we're not training specialists who are going to treat disease exclusively. Because again, I think there's a lot more we could do to prevent disease, a lot more we could do, again, higher upstream. I'm saying this upstream system, there's lots of causes to disease, and unless we really focus on those causes, we can end up spending a lot more money than we need to treating diseases that never needed to occur. So, good question.
Great. Yes?
Just bring it down to the streets of Brunswick, Maine, this healthcare issue. And I've heard a lot of things tonight that were really interesting. I happen to be very privileged to sort of work as a on quality improvement and cost containment within the state of Maine. And so I know some of what's happening here, but I don't know everything. And I don't know everything that's actually happening in Brunswick. And I do think it's important that those of us who serve in the political realm representing this part of the state do understand what's happening in our own community in terms of the healthcare services that are offered here and what's available to people. So I just would like to pose a hypothetical question to our panelists. And the question is, if I was over the age of 18, but below the age of 65, and I worked at VIW and I was laid off, and I couldn't, after a short period of time, afford my COBRA, so I became uninsured. And I had some sort of chronic illness, whether it was heart disease, diabetes, if I had cancer and I was in remission and all of a sudden I started to have symptoms again, where would I go in Brunswick to get the type of services that I need to sustain quality of life, to continue to support my family, and potentially to save my own life? I mean, I heard someone talk about the emergency room, but my understanding of emergency room here is it's simply that. You cannot get you can just be in, they just go in if you have an emergent situation, they stabilize you. You can't get ongoing care. Like you break your arm, they splint it, but you can't go back the next day and have it casted or have surgery or have physical therapy. You have to have insurance for that. So I'm wondering, in Brunswick, this is happening to people. Lots of people have been laid off about, VIW that live in this community over the last 15 years. And if they can't afford their COBRA and they don't qualify for Maine care, where do they go in our community to get the services, healthcare services they need? That's just a question.
Can I jump right in? Is it okay if I jump the order?
Sure.
Change it up a little bit. I just actually found this out. I was having a problem. I was trying to find where I could go, and it was I was on the weekend, so not a lot of places were open. I normally go to Bowdoin Medical, and there's the Oasis Free Clinic, which provides free care for folks to walk in off the street. There's also now the Mid-Coast Care Center, which is right near where the new Amtrak train station is. And you can go in there, they have hours that vary from all the other places, so they're trying to fill that gap for folks, and they do provide free care, and they also provide tiered care. And they work on chronic conditions, which I thought was really cool. You can walk into the hospitals. There is a free care system that you can demand. The problem is you have to go in and say it before you start having services. I'm also a big fan and advocate of Planned Parenthood. It doesn't matter if you're male or female, you can walk right in there and get preventative services, and they put it on a tiered form, and if you have no money, that organization is going to keep working with you to make sure that you are getting the care that you need. So I'm hugely impressed by what Planned Parenthood is able to offer. Most folks just think of it as where you go for reproductive health, but they'll help you with a cold, they'll help you with a chronic condition, and they'll help you with basic injuries and help you get the care you need. So there are places in Brunswick where you can go. Now, I would like to see those areas increase, and I'd also like to see folks aware of where they are. I honestly didn't know where they were, and I've just found out, and I think we all need to be aware of where those services are located in our community. And as your state rep, I'd definitely like to publish something to send out to folks about where these basic services are and where people can go.
Mr. Horch?
Yeah. Well, I think Mattie pretty much covered it. I was going to say Oasis would be my first recommendation because they are a free clinic, but the new clinic, the walking clinic near the train station is also available. And to follow up, sort of, I touched on this in my opening statement, but the idea of really helping people have meaningful, informed choices, you really have to know what services are already available. And so your question is a great one. I do think that the state, working in partnership with local providers, could do a better job of getting the information out to folks about how they can protect their own health and where they can go if they need services. It's the kind of thing you think, well, the people should take, responsibility for their own health, and the private market may, cover this. We don't need to have government intervention. But there's really good evidence and good reason to believe that this healthcare problem cannot be left up to the market. You can't expect people when they're sick, when they have a crisis, to suddenly become informed consumers. There is a role for government. There is a role to help people learn about these services before they need them and not in a panic when they really are desperate. And your point about COBRA is a great one because that's what happens to people. They're covered, they lose their job, they have a pre-existing condition, and some of that is addressed by the Affordable Care Act. So you might say we're making some progress with Obamacare, or before that it was called Romney Care, but it is better than what was before. It's not right that you'd be forced off your insurance and then you couldn't get new insurance because you had a pre-existing condition. But again, there's a better way to do it than Obamacare. And the question, which is a very good question, is Obamacare moving us closer to the system we really deserve, a universal system? Or is Obamacare going to divert a lot of resources to private insurance companies and make it more difficult to have that public insurance system, which will end up being more efficient and more affordable? So we are having a real, legitimate, honest discussion, and I just encourage folks. It is very politicized. It is a Democrat versus Republican issue, but both sides have good ideas here. Both sides have valid points, and so I would just encourage folks to accept that Obamacare does have some good things, and there are some good things coming out of it. But again, it's not where we need to be going. And so we really do need to listen carefully to affordability, to universality, and make sure that motion is progress. Because we can change our system, but if we just change it and not improve it, it's not any better. So it's a very good question. And to wrap up, Brunswick actually has great services that other communities in Maine don't have. So this is a statewide problem. Brunswick is a very wealthy community on the level of Maine. Other communities are not so fortunate to have the health resources we have. And so your question would be much more difficult to answer in other communities. I'm very glad to be living in Brunswick and to be able to offer you some real solutions here. But if I were running in other parts of the state, my answer would be more grim. So thanks for the question.
Yes, if I had just lost my job and had a serious medical issue, then of course I would be looking on an entirely different avenue. But I know the stuff, the care and the organizations exist, and if you reach out to those people around you in this community, I think I could say very, very fairly and very honestly that people would help you. Thank you.
To further answer your question, because I can, is that in District 66, there's several people right now that have life-threatening illnesses and diseases that they had while they were at work. They lost their jobs. They have cancer and some of those issues. Working through with their legislator, and each one of these people, well, one of these people are going to be able to also do it, and working with the federal delegation, we've been able to keep those people not only alive, but getting treatment and getting their cancer medications that they could not afford any other way. So you work with the federal delegation, you work with the state delegation. One of these people will have to learn how that all works. We'll teach them. Further questions? Ma'am, you had your hand up.
Yeah, I'm Anna. I'm the one with the chronic Lyme disease. It's something I've had for 7 years. I've dropped out of college twice because of it. And I've really never been able to hold a steady job. And all of this, I mean, I'm on my parents' health insurance thanks in large part to Stan and the legislature. And so that's hugely helpful, but I'm also doing a lot of alternative things that aren't covered. And my parents are eventually going to need to retire, and at this point I've basically put that off, you know, good 10 years. And so I'm wondering, I've heard a lot of like great big picture stuff, and I'm wondering, you know, every week that goes by without change to this law, I have another 3 appointments I have to pay for. And so I'm wondering what you would do right off the bat, and how we can sort of get a solution, maybe not a perfect one, but something that can help so that I don't have to be, you know, a burden on my parents, so that I can get health insurance that's paid for. And the other one, just specifically, Lyme disease officially, chronic Lyme disease does not exist due to one study that was too heavily weighted that turned out to be flawed. It's now going into review, but tick-borne illness is becoming a huge problem, and I know that Lyme disease is not the only illness this has happened to. So I'm wondering, you know, in the perfect healthcare system, single payer, whatever, how do we deal with diseases that don't officially exist yet?
Yeah. Well, I'm very sorry to hear about what's happening to you. And again, you're not alone. There are many people in your situation. And I really want to help. I want to serve and do everything I can. As Stan mentioned, there are things that our legislators can do. I can't do it unless I'm elected. So that would be my absolute priority. As soon as I'm elected, I've already been contacted by many people who have specific questions and concerns like you have. And that's my business, is to find out everything I can find at the state level or beyond to help you. So that would be my promise to everybody in Brunswick. If you elect me, I will work hard for you. Specifically, I don't know what we can do. It sounds like you have a good network. I know you're a good friend here. So you're one of the lucky ones, actually. Some people are in your situation without friends, without family. So we do need to do everything we can as elected officials and as community members to support one another. But we should have a better system. You shouldn't be telling your story. And if you were in another country, you wouldn't be telling your story. It's because we have the system we have that you're having to tell the story to us. So I'd like to change the system. I'd like to make sure nobody, you know, again, my dream would be the next time I run for office, I can say we did it. And we don't have to have these stories. These are stories that are deeply disturbing. Living in America, living in Brunswick, we shouldn't have this. The question about diseases that are unknown, My wife is a neurobiologist, so she does federal research. She gets grants from the National Institute of Health. My father was a neurophysiologist. I believe in basic science. I believe in research and education. And we will find out how to treat, how to diagnose, and how to cure Lyme disease. It obviously exists. I know several people in this room that have had Lyme disease. We just don't know what it is, how to treat it effectively. We don't really understand a lot of diseases. We don't understand how our bodies work. And we need to invest in this. This is what government can do. No private company can do this. We can't have the market solve. You can't take better care of yourself. If you are bitten by a tick and get Lyme disease, you will be sick. And this is not something that you yourself, your family can help you with. This is why we need government. This is why we need services. This is why we need research to understand how to treat this disease and how to prevent it. Maybe there are simple things we could do so that nobody gets Lyme disease in the future. So I'm very sorry to hear about your situation. If I am elected, I will do everything I can to help you. And again, I will do everything I can to help anyone else who's in that situation.
Well, this one is kind of personal for me. I have known Anna for a really long time, and we've been best friends since high school. So I've seen you through all the different cycles of this illness. And I think the #1 thing we need to do with Lyme disease and many emerging diseases, the reason I mentioned the Epstein-Barr is because that's actually what I have. I had a mono case that just keeps on giving. And what we need to do is definitely fund research. I'm really excited to say Anna and I were looking into it. One of the congressmen from Rhode Island has introduced a federal bill where they're going to be funding a research group to look at Lyme disease and how we recognize it as a country so that folks will be able to get coverage under their insurance for alternative care. And here on the state level, what I would like to see and what I'd like to do is make sure that Lyme disease is passed a bill that sort of recognizes that it isn't a short-term infection, that it can become a chronic condition, and that the one-size-fits-all solutions that we have right now won't necessarily work. The problem with Lyme is that it throws a lot of strange symptoms and false negatives and false positives, and we need to equip consumers and patients with the ability to discover the care they need. We're not quite sure how it works, and we need to have a system that allows doctors and patients to explore other avenues to try to treat a condition. So I think that's a big thing that I'd like to push for. Lyme disease is a huge issue in Maine. I'm not quite sure where this leads, but we've discussed this. There's a vaccination for animals against Lyme disease. And that's what some folks are looking at, is if that's something that can be implemented on a human level and whether it be safe, would it be interesting.
At one point, but it caused arthritis.
Yeah, so, it's not perfect, and so I think the basic answer is always it comes back to education. We need to be funding research, we need to be funding educational opportunities so we can understand how our bodies work. I mean, look at how far we've come in the past 200 years of understanding medical science, and think about how far we're going to go in the next 200 years. And, as your state representative, I'm going to work hard to make sure that we're funding that type of research. Another thing is when you do have a chronic condition like that, that's not necessarily recognized by the medical establishment, is we need to work to make sure that you're getting, if it is causing a disability, we need to make sure that's getting disability coverage, enable you to have access to disability insurance, voc rehab to find an adaptment so we can make it so that you can work with the condition that you have. And I'd like to strengthen those systems and work towards that. And as Fred said, I know everyone here is going to work their butt off if you elect us to make sure that we're taking care and ensuring that your individual needs and the needs of the community are being met. So.
Straight.
I don't have a solution, obviously. I do feel very sympathetic. One of the things, there is progress being made, obviously, of course. A few years ago, people went to doctors for diagnosis, and it's only recently that people are looking for the tick as the cause of the problem. So at least now doctors are recognizing it, and we're coming a little closer, I'm sure, to solutions. I spend a lot of time outdoors in the woods and so on myself, and I've asked about inoculations and so on. It is not here now, it will be eventually. Once again, I would mention, talk to as many people as you possibly can. find out from the other people in the community. All doctors do not treat the same things, same problems, the same way. I would get more than one opinion, find out as much as you possibly can, and whichever one of us goes to the legislature, I'm sure we all would try to help as much as we can. My heart goes out to you. Thank you.
So we're going to have one more question. It's going to be a brief question. It's going to be, I hope, some sort of a brief answer to it. Unless it's earth-shattering and it's one that we haven't heard yet tonight and it's going to solve the problems of the world. Anyone would like to ask that last question? I was going to ask Tibbetts, but he seems to have walked out.
Hi,
Yes,
yes or no? The tobacco settlement money that comes to the state of Maine goes into a fund for Healthy Maine. And years ago, the bipartisan legislator looked at some prevention programs that would prevent disease and save Maine money. In this last year, fiscal year, the governor proposed to eliminate many of these programs: Head Start, Visiting Nurses, Healthy Maine Partnerships. And I looked to my legislators on Health and Human Services and Appropriation and others to restore that funding. So if a budget came up that included elimination of Healthy Maine Partnerships and other public health programs in Maine, would you oppose that?
That's a question worth asking. Mr. Horch?
Yes or no?
Yes.
Thank you.
Ms. Daughtry?
Yes, am I allowed to put one sentence in? I absolutely agree, and I was up there protesting in Augusta.
I couldn't say yes or no. I could not say yes or no because I've only heard one side. Thank you.
That's fair.
That's fair.
Okay, now we're going to have a moment for the candidates to summarize what they have to say and to ask you for their vote, because that's what they're really here to do. And I'm going to start with Mr. Mayor.
Okay. I'm not going to bother to go to the podium. I'm running because it seems to me at this particular point in time something I'd like to do. I don't have any axe to grind. I don't have any laws that I want to write. I don't have any of those kinds of things. I want to leave Maine a better place for my grandchildren, the ones that come here and visit and the ones that live here all the time. I'd like them to be able to stay, if they so desire. I'd like Maine to be the place. Maine's been an awesome place all the years I've lived here, and I want to make sure that some of those things that I've enjoyed and experienced and loved, they're still going to be here for my grandchildren as they age. That's important to me. I'm not wise by any stretch of the imagination, but I've lived a lot and I've seen an awful lot in lots of different places. And one of the things I've learned with my education experiences is I can read pretty well, I can learn, and I love to learn. And I'm okay with making decisions. My wife would tell you that some of my decisions aren't right, but nevertheless, I can make them just the same and stand behind them. And I have a strong work ethic, and I believe District 66 is probably the most awesome place that I've ever lived in my life, and I live here out of choice. And I will continue to live here for a bit longer. And I would like to represent the people that are in District 66 also. Thank you.
I want to thank you all for coming again tonight. It's great to see a huge turnout. I think that's one of the best things about District 66 is that we're all fired up and ready to get our hands in and make sure we're working towards the solutions we'd like to see for our community and for our state. I'm running because there are so many things that we need to shift and change on our state, and so many needs of our community that need to be addressed. We need to take a look at education funding and making sure our public schools are supported and strengthened. We need to make sure that we have affordable and accessible health care so that no one's being bankrupted by their basic health rights, health needs. We need to be making sure that we have sustainable and affordable energy. And there's many, many other things, but the basic reason I'm running is because I have skin in the game. Like all of you, I care about Brunswick. And this is where I was raised. I always knew this is where I wanted to stay. This is where I want to raise my children, and I want to see my grandchildren grow up and make sure that they have a viable and vibrant Brunswick. You know, I'm going to work for any effort that will advance our state in a sustainable future to make sure that we have the best and brightest future. I also want to say that I have been working up in Augusta. I have worked with both sides of the aisle. I've been doing legislative research and reporting. I know where the bathrooms are, so I can hit the day one, start working for all of you folks. And I think it's important to stay informed, and that's why, as your representative, you've heard a little bit about where I stand. But in this campaign, and if you elect me, the most important thing is what you think. That's what my job is to make sure I'm representing all of your interests. And that's what's going to guide me. It's not going to be, I'm a Democrat and I firmly believe in being a Democrat, but we need to make sure that the needs of District 6 are being met and being served. And the needs of District 66 will be always what guides me. It's up to you folks and it's up to the constituents. And I hope that you'll put your faith in me and elect me and send me up to Augusta so we can start working and crafting real solutions. I don't have all the answers. This is going to be a team effort. It's not about any one of us. It's about building a sustainable and vibrant, creative, amazing, amazing future for Maine. And all I've got to say is, as our president says, I am fired up and I am really ready to go, and I want to be your representative for House District 66. I appreciate your vote.
All right. Well, I'm about as fired up as Mattie is. This has been a great campaign. I'd like to thank my opponents. Thank you all for coming. You have 3 good people to choose from, so we are very fortunate here. But only one of us has experience and commitment and values like I do. I have business experience. I was an attorney. I'm committed to Brunswick. I have 3 kids in a public school. I have a wife who's got tenure at Bowdoin College. So I'm committed. I think my experience comes from outside Augusta, but it will serve us all very well. So that's what differentiates me from the other folks. I'm also running as a Green Independent. So again, I hope that people here have seen some of the difference between what I'd like to bring to the legislature in terms of thinking about healthcare. And again, I'm thinking about preventative care. And so Melissa's question about, could you support this budget that cuts preventative care? That's an easy one for me, because I believe that our best investment is in prevention. And so any budget that cuts those programs is going to be misguided. So my priorities, again, in terms of healthcare, I think we need to look at a healthy environment and do everything we can to make sure we have a clean and healthy environment for all of us to enjoy. I believe we need meaningful and informed choices so that we're not subjected to risks in the workplace that we're not aware of. We're not subjected to risks when we buy products. We can't choose to be healthy if we don't know what's in the products we buy. So labeling laws are important to me. Again, I believe in meaningful and informed choices so that we can make good choices for ourselves. And then the final issue, which is on everybody's mind, is how do we pay for all this? What can we afford? With the money we spend now, we could cover everybody. We could do a better job with the money we're spending now. So it's not a question of adding more money to the system. It's a question of being intelligent with how we're spending the money we already are spending. It's a question of being fair. It's a question of making sure everybody gets the health care they need. If we do that, we will all be healthier. If we do that, we will all be more productive. If we do that, we will all be better off. And that is what leads to long-term sustainable prosperity for everyone. So again, I like your vote. I'm very excited. I'm knocking on a lot of doors, talking to a lot of people. I almost won last time, so I have a good chance this time. I understand how concerned people are that I'm not a Democrat. I'm sorry, I am not a Democrat. My grandfather was a Democrat, and my other grandfather was a Republican. So I've grown up listening to both sides. I think that everybody has good ideas. And again, I really don't mean to be putting anyone in discomfort. I don't mean to be threatening anyone by running as a Green. I just think that my own values and what I'd like to do for you, the Green Independent label, is really what describes me. When I hear sustainable, when I hear long-term thinking, I think green. And I hope that this message gets across. Again, I'm not running to send a message, I'm running to serve. I think I have the skills, again, I think I have the experience, I think my life experience can be useful. I haven't been to Augusta, but I've experienced what comes out of Augusta. I've been working on Main Street, so every bill that comes out of Committee on Energy has affected me and my customers. I've talked to thousands of people over the years. I've been on Main Street every day for 5 years talking to people. I've already run a campaign. I got almost 1/3 of the vote. So I feel like I have a very good sense of what Brunswick is all about. and I'm committed to our community. As Grant said, this is an awesome place to live. My family has chosen to come here. My grandfather grew up in Moncton, Canada, and came to the United States for opportunities for work. But we were delighted to be moving back closer to the ancestral home. My mom was so happy when she found out that Hadley, my wife, got a job at Bowdoin College, and we are delighted to be here. I would very much like to serve. Please give me the chance. Vote for me in November. Thank you.
Say something, and I can say it from where I'm standing now, because I remember where they're sitting now, many, many years ago, and what it's like to come into a room, and this is the third time they've done it, and answer questions that are very serious and very deep and very thought-provoking. How do we educate our children? How do we create jobs? How do we take care of our health better and try to afford it? These people don't know how to build a battleship, but we're asking them for the details and the blueprints of how to do something similar to that. They haven't served in Augusta yet, but we're asking them to tell us how they're going to not only solve the problems of Maine, but the country and the world. And they've done a tremendous job. I've been at all their debates. I'm really quite proud. Because we're all asking questions, what they're all answering is their commitment to their community and their state and their country on wanting to serve and make it better for all of us. So I want to really applaud these candidates, because it's not easy where you want to go. And maybe you get there. But especially when you applaud and thank the people that have been coming. I mean, this is what it's about. Mr. Tibbetts, I was going to ask you earlier, but you weren't in the room.
Can I just make an observation that all of the candidates remember is the Affordable Care Act. The Tea Party and Republicans call it Obama. It's not Obama. Because,
the Affordable Health Care Act, I think, follows what Derigo did to begin with. So we all have different memories. But I want to thank everybody for coming out on these nights and participating in all these forums, whether it was education or health care or jobs, because it's really about serving the people. So thank you very much.
Thanks for coming.